So a lot of sinus pressure, head pressure, tension in my skull, my face, down, and then speech problems, swallowing problems, and then into breathing problems into my chest. It's kind of like here down.
Gotcha. And in the consultation, you mentioned you had some surgery done?
Yeah, I've had 3 sinus surgeries in the last 4 years.
Gotcha.
Yeah.
All right. And where's the most of the sinus pressure?
Like right, I would say behind the nose and between the eyes, all right here.
Got it. All right. So I definitely want to focus on that neck over there. Okay. And also the rest of the spine. So because if this is not stable down here, then there's no way anything in the neck can be stabilized either. So that's what we're looking for right now. Got something over here. Not too bad. A small little bit here. There she is. Okay, that's stuck. There you go. That's fine. So. Okay. Let's see if it's stuck. How's this fella right here?
Yeah, here's a little.
You see a lot of swelling over here. So. How's that fella right there?
A little tense.
Yeah, that ain't moving.
Yeah.
The rest of your spine's moving just decently. Well, yes, you do have a gap over here showing a potential second sacral segment. Right now, that fella is staying put, so we're not going to disturb that. But what I do see is that your foundation itself is tilted down this way.
Yeah.
So we have a posterior inferior, so a PI-L sacrum over here. But that's the reason why, because it's tilted this way,
This is tilted.
the rest of your lumbar is also tilted to compensate.
Yeah.
Go along for the ride. And since we can't go along this way, that's why your head, along over here, the rest of your body start recompensating. That's what we see over here. Left, right, left, right, left. So I'm gonna double check what's going on with this fellow over here. This is most likely a compensation turning to subluxation over here. And that 6th circle over here. This region over here, these nerves are responsible for, as we see over here, mucous membrane, all the glands, so on and so forth. Okay. So clearly, if this nerve is not working too well, we got one heck of a traffic jam in there.
Yeah.
What it can do is basically cause up even more overreaction in the area. But in addition to, we also got the surgeons. They basically, what I see on the X-ray over there, we're gonna touch base on that in a moment. Okay. So there's supposed to be some conscious, some turbulence, right? So I see actually a lot of it's chiseled away, okay, on your left-hand side quite a bit. Yeah, and I'll show that to you in the X-ray as well, okay? Now, the purpose of these turbulence and the conscious is primary purpose actually is to create that vortex effect, right? We don't want just a straight wind tunnel in there, okay? We want a wind tunnel effect, but we want like that tornado vortex effect to push all that air in there, right? And in addition to, get all that debris out of there. However, because your sinuses and everything else are slightly misaligned, instead of having like a nice smooth, like a wing or an edge or what have you, no. Now we got this. So the debris starts building up all the way up to here.
Yeah. Okay.
Now, if this becomes long-standing and chronic over time, well, how does the body get rid of it? Well, if we can't blow it out or what have you, right? Our bodies start producing more mucus. Mucus has a lot of white blood cells to help digest and break this down. If that doesn't work and it keeps on building up even more chronic time, your body starts to create all these polyps.
Yeah.
To increase surface area to have even more mucous membrane and more white blood cells to try to break down all this debris out of the way. So that's where we're going to come into play. We're going to address these subluxations. We're also going to realign your skull to reduce and realign as much as possible. So therefore your body can reabsorb all that debris out of the way.
Yeah.
But in terms of that turbulence, note that's a done deal. Why? Because the surgeons cut it out, and I can't grow new ones in this place. This is your septum over here. I want that to be a straight line, But you see over here, it's like zigzagged.
It's like my spine.
Yeah. Same thing with this terminate here. See this one over here? Where's that one?
Yeah.
They shaved it off. Same thing with this one over here. Where's the terminus over here? They shaved it off. The maxillary sinuses, these are all clogged up, filled up, okay? What's going on behind your nasal, sinuses? It's also clogged up. Frontal sinus, it's a little higher than that. Sorry, it got cut off. But yeah, I'm seeing even from your end, from visually, it's still misaligned.
It's still swollen. Yeah.
So no, we're gonna address all of that stuff. Good. Come on up, please. There it is. Just rocks. All right. Come on. Okay, so this is fine. See, there's your deviated septum right there. There we go. There's that fella. Okay, got a little more deep in there. Good. Both maxillary sinuses are gone. There we go.
Oh.
This is okay. So nasal bone's out. There we go. No. Oh, a little more. This is stuck. There it is. Oh, this is really stuck. Good. Now this feeling's out. There we go. Come on up.
I can feel a little. Things are like happening.
What's happening?
I can feel one of the biggest things I feel a lot. I'm always like pushing to I'm physically trying to open it up. You know what I mean? Like I'm pushing forward or up wherever the sinuses are, and I can feel that. I can feel a bit of a sensation of things moving around and whatnot.
All right. Anything else?
The breathing, but my ear, I noticed both the ears kind of popped a little bit, which is good because I know my ears are never able to pop at all, to be honest.
Hey, that's good.
Yeah, a little bit. So I noticed there's definitely, I can feel stuff happening for sure. I still feel a little bit there's definitely more air coming in for sure.
How much better would you say right now?
Yeah.
Before?
Much better, yeah. Especially the breathing.
Well, ballpark figure from 0 to 100%.
70%, 80% maybe.
70, 80%.
Yeah.
Okay, that's good. Do you notice any drainage occurring?
I know. Right when I got up, I noticed it, but right now I don't feel any, but I did feel a little bit.
A little bit when you came
Yeah,
up?
when I was standing. Right when I got up, it started feeling a little bit
Good, okay.
Yeah.
So this is our common expectation, okay, for those with sinus drainage.
Mm-hmm.
For the next 36 to 48 hours, either A, you may feel like a huge waterfall going back in your throat, okay?
Okay.
Number 2, you may feel like a trickle going down your throat.
Okay.
Or 3, it feels like it says, it should be something going on, but there's nothing coming down your throat that you feel like it says, I gotta cough something out. I don't know what's going on in there, okay? So we're talking a very small little trickle. You just may not notice it. Okay. So those are the 3 potential scenarios you may experience over the next 36 to 48 hours, all right? Okay. Now, speed that up, I do recommend a nice steam bath, okay? Or even better, get a steam bowl, drape your head with a towel, breathe all that steam vapors, so you can flush all that junk out of there, okay? If you are gonna do a neti pot, I do recommend use distilled water. Don't use, don't use any other regular waters because you don't want any pathogens introduced into your skull in there, okay? Okay. All right, that's what the story is, brother.
Okay, thank you so much.
You're very welcome.
Thank you.
I'll see you next time.
Yeah.